I call the meeting to order. This is the joint entities meeting, Monday, October 18th, 2021. Welcome, everyone. I'm Louise Fromm from University Heights, and I have a newly appointed city clerk, Mike Haverkamp. And for introductions, I'll read each entity, and then each can respond however they want, who's in attendance, staff and elected officials. So Johnson County Board of Supervisors.
At Hayden here.
Ray Forsyth, Special Projects Manager.
Donna Brooks, Grants Coordinator.
Allison Wells, Grants Assistant.
Lisa Green Douglas, Supervisor.
John Green, Supervisor.
Roy Sam Porter, Supervisor.
Thank you. We'll go to City of Iowa City.
John Thomas, City Council.
Pauline Taylor, City Council.
Mayor Bruce Teague, City Council.
Laura Burgess, City Council.
Janice Weiner, City Council.
Jeff Fruin, City Manager.
Rachel Kelberg, Assistant City Manager.
Thank you. We'll go to City of Coralville.
Laura Judrich, City Council.
Jill Dodds, City Council.
I and so
Ellen Habel, Deputy City Administrator.
Thank you. We'll go to City of North Liberty.
Terry Donahue, Mayor, North Liberty. I think that's it.
Okay, thank you, Mayor. City of Tiffin.
Doug Bolt, City Administrator.
Skylar Limkman, City Councilman.
Okay, I'll go to City of Hills. Is anyone present from City of Hills? Okay, we'll go to the school districts. We'll start with Clear Creek, Amana. Okay, we'll go to Iowa City Community School District.
Sean Eystone, Board Director.
JP Clausen, Board Director.
Charlie Eastham, Board Director.
Superintendent.
Thank you. We'll go to, is anyone here from the University of Iowa? Or are there any other entities present that I didn't list or someone I missed? Okay, thanks everyone. Welcome.
Mayor Fromm,
yes.
Kelly Hayworth's just coming in right now.
Oh, great.
And Megan Foster.
And Megan Foster, all from Coralville. Thank you. Okay, so now that we've done the introductions, we'll go to discussions and updates. So the first one on the agenda is update from cities and county on federal ARPA planning and discuss possibilities for collaboration. Iowa City wanted to discuss this in Johnson County, and I know we have 3 staff from Johnson County. Maybe they'd like to start.
Good afternoon. My name is Donna Brooks. I'm the Grants Coordinator for the Johnson County Board of Supervisors. I was asked to submit this agenda item on behalf of the board office. And I just wanted to take this opportunity to introduce myself and some of the other staff. If you have not met us already, we've met one-on-one with many of the entities in the county at this point. But again, my name is Donna Brooks. I'm the grants coordinator. We have Ray Forsyth, who's our special projects manager, and also Allison Wells, who's the grants assistant. We have a couple kind of pertinent upcoming events. Johnson County began a public input series process in August that concludes on Wednesday, October 27th, with our 6th and final public input session that will take place from 6 to 8 p.m. at the Johnson County Administration Building. And our facilitators, Bolton and Mank, who we contracted to assist us with the public input process, will present the results of the data that has been gathered over the past couple months during our series of 6 public input sessions. The format will be about an hour of presentation up front and then an hour for public comment following the presentation from Bolton and Mank that summarizes the public input findings. I'd like to remind all of our entities that we have a public survey available on our website that closes on October 25th. And we'd like to encourage you to please share that with your residents and stakeholders. Any entity can request an information kind of drawdown from us. We can sort that by the different communities in Johnson County. So if you're interested in seeing how residents from your entity responded to that public input survey, we're more than happy to provide that information with you. You can just contact myself, Donna Brooks, or our grants assistant, Allison Wells, and she or I can share that information. Right now I am pasting a link that is direct to our survey in the chat. And this information is also available on our ARPA website, which is johnsoncountyiowa.gov/ARPA, ARPA. We have been undergoing an internal funding needs assessment to identify possible eligible projects that expand or create public service, enhance public services, or create new public services that were identified as needs or priorities as a result of the pandemic. That's been discussed over the course of several work sessions and is continuing to be discussed. And the timeline is kind of that this internal funding needs assessment will conclude at about the same time as our public input series, and then those will go into the budgeting process this November. So that's kind of where Johnson County is at on a timeline in terms of discussing and allocating some of those first tranche funds for what we have identified to be kind of our first priorities in terms of urgency, readiness, and the operational infrastructure we have in place to get these projects off the ground within the next 6 months. Throughout our internal funding needs assessment, we've identified several projects that we would be interested in collaborating with other entities on. And I'm in the process of updating this document because it's being discussed weekly and we make progress every week. But this lives on our ARPA website as well, and you can find it there. But we were just hoping to have a bit of a discussion about how other entities were going to be investing their local fiscal recovery funds and what opportunities for collaboration presented themselves. So that's my spiel.
And this is Ray. I would just like to add, a couple ideas on collaboration. Could be a healthy homes program, a lead abatement, daycare opportunities, affordable housing, all kinds of things that we could pool our funds or resources and partner with each other to enhance and bolster some of these programs.
Okay, Iowa City also had asked this item to be on the agenda. Did they want to add anything?
Yes, and this is Mayor Teague with the City of Iowa City. I'm going to actually call from our city manager's office, Rachel Kilberg, who is our assistant city manager, to discuss this topic on our behalf.
Hi, everyone. Yeah, I can just kind of quickly debrief where the City of Iowa City is at as well. So throughout the summer, we had held some comprehensive public input opportunities. We also had a survey, some public input sessions, and then some targeted meetings with stakeholders. We know that there will need to be more opportunities for public input as we go forward, but that was kind of our first phase. And then moving into the fall, in early September, we presented those findings to our city council, as well as some initial recommendations for this first tranche of funding. And with our council support, we kind of identified what our priorities are going to be with this first round of funding. And we've broken that into two kind of categories. The first is emergent needs, kind of recognizing that there are individuals, households, organizations out there right now who are still being financially impacted by the pandemic. And then the second kind of category, which what we call strategic investments, more of those kind of transformative investments that can have a longer term impact. So I can just briefly recap what the priorities are in those two categories. On the emergent needs side, we're looking at direct payments specifically to individuals who missed out on previous federal stimulus checks through COVID relief bills, looking at eviction prevention, housing repair program, and then emergency financial assistance for nonprofits. And then on that more strategic investment side, we're also looking at supporting BIPOC businesses and really building kind of a framework for them to get started and to grow, doing a social service needs assessment along with capital planning for social service agencies in our community, continuing to invest in affordable housing, mental health, workforce development, climate and natural disaster resiliency, and then looking at some small business, arts and culture and tourism support. So those are kind of our big priorities. We're now kind of moving into a phase of looking for opportunities for collaboration. We, like the county, believe that if we work together, our dollars will not only be stretched much farther, but it'll also be a much more streamlined process for individuals and organizations who are trying to access our programs. So we've been meeting with the county regularly, and our city council is also planning to hold a joint work session with the Board of Supervisors in next month.
Would any other cities like to share anything? Or is there questions?
Louise, the city of Liberty, North Liberty, we're at the place where the city administrator issued a memo to our council folks as far as where would replacement funds go and how far that need may be. As far as drilling down on things, we are not there yet. We've taken the opportunity to talk with our local pantry people as far as their particular needs are concerned. We've been monitoring what the other jurisdictions have been working toward and where they would like to distribute their funds before we make a final judgment call. And the things that have really cropped up very recently, maybe in some places, but not all of them, is that daycare is really getting hammered. With the different types of government rules that they have, they can't sustain that the staff that they had, they're cutting back hours. That is becoming crucial. The other thing is in monitoring our energy futures in the coming days, we're looking at maybe possibility of utility replacement costs in some of these situations where you have natural gas that's going to be going up anywhere from 50 to 95%. And, you know, people are behind the 8 ball at times when winter heating is concerned anyway. But this just is throwing gasoline on a fire that's been in the past. So that's a direction I've been looking at pretty extensively myself.
Thank you. In University Heights, we've been working with the group from, thank goodness, from Johnson County, who's helped us. We've had them come to a meeting and talk to council. It is a little tricky navigating through it. And we have talked a little bit about collaborating with cities, possibly with some things. We've also talked about helping some of our businesses, but we're waiting to hear more public input because we're kind of unique and we're going to have to work through some of these things. So we're interested in some collaboration if you can think of some things that will work that way. And that's about it for now. So if Iowa City, you know, who surrounds us is interested in looking at something together, you know, we'll look at that too.
And the final thing I was going to note is that Johnson County has expanded our general assistance program, and all residents of Johnson County would be eligible to receive some of that emergency financial assistance if they were at or below 200% of the federal poverty guidelines. So there have been a lot of barrier reductions that have occurred to really allow this funding to meet those residents of Johnson County who need it most. So I'll go ahead and drop a link to our general assistance program in the chat box as well. And please encourage any residents you may know who are in need of a financial assistance to look into our recently expanded general assistance program. Thank you.
Thank you. Would anyone else like to discuss anything? Get any more clarification, what they're working on? I don't know. I know the school board's been working on some things too, but did they want to report any here?
JP Clausen, Iowa City School Board. We're talking to our bus drivers. They made a request to us to put some of their funds their way. We don't employ them. We actually contract with Illinois Central. So we're, again, right now, we're just engaged in a dialogue with them about that.
Thank you. Are there any other questions or concerns or comments? Okay, thank you very much. We'll go on to COVID-19 update. The county and I asked Sam Jarvis to give another report, as he's done every meeting, about COVID-19 update. And Sam, thank you so much for coming. I see you're on. You can start right now about your report.
Good afternoon to everyone, and as always, appreciate the opportunity to provide updates on our COVID response. As many have probably seen and are also keeping track of, we've seen a decrease in our cases over the past couple of weeks, which we're very happy about and happy to see. Hopefully we're seeing the downward trend continue back into single-digit cases as we work to curb this Delta variant. As we've reported out in the past and over the, since end of July, predominantly all of the cases we've been seeing are the Delta variant, which is more contagious. And so from our local cases and trends that our case investigators are looking at, again, primarily cases in unvaccinated households. And so we know that once someone gets ill, other folks in their households are very likely to get ill as well. We have seen breakthrough cases too, which is not uncommon or unheard of. And certainly things like severity or time of exposure and things like that make a difference. And so we're matching up with other trends that we're seeing across the state and nation. But currently we are still in high transmission. Roughly about 84% of the counties across the US are still in high transmission. Though I believe most states are reporting a decrease in cases over the past week and a half to 2 weeks. So we're headed in a good direction. And what a perfect time as we enter the fall and winter season, flu season, and other respiratory viruses. So on that note, for testing and cases, a huge thanks to all the municipalities on this call who have stepped up and assisted with being a Test Iowa at Home test kit pickup site. That's a huge benefit. We're a very fortunate community. We've got roughly about 16 plus sites across Johnson County where persons can come in and get a test kit when needed, and that really helps with access. The State Hygienic Lab had just sent out a note earlier this week that the first week of this expanded access kind of program across the state, they had a really successful first week. Roughly about 600 extra kits were received due to these efforts. So thank you to everyone who's participating and helping provide that access, as it will be absolutely crucial and necessary as we go into flu season. We hope that we don't see flu as much as we have in the past. Certainly last year was a testament to wearing masks and physically distancing and staying home on the road, keeping that vigilance of our layered approach. But we know vigilance is not the same as last year. So we're all very much wondering what this fall will be like. So we continue to encourage folks to get their flu vaccine. If they haven't been vaccinated for COVID-19 yet, to please do so. And we'll continue to share updates on information about vaccination and boosters as it comes out. We know that as time goes on, it continues to be complex with recommendations and when to test, where to test, when to get a booster and when to get a third shot and things like that. So we're happy to continue to answer those questions and provide information. In terms of our vaccination status, we continue to be or have the highest vaccination rate across the state. Just recently, though, for our 18 plus category, Buena Vista County is beating us. They're at 75.7% and we're at 74.8%. So kudos to them. I'm sure we'll catch up pretty soon, though. We've had a good trailing run, but I'm very glad to see other communities across our state get vaccinated as well, too. But overall, our total population is about 64.3%, and that's including everyone. So the next large large horizon that we're waiting for is that November 2nd and 3rd meeting that the ACIP has scheduled, for the Advisory Committee for Immunization Practices, and that's where they'll be discussing vaccinations for 5 to 11-year-olds. We know that they had just met this past week to discuss Moderna and Johnson & Johnson boosters. And we're waiting to hear more from the CDC to make those declarations of what they would like to see everyone do based off the evidence that they've viewed. So other than that, I believe that's the majority of the highlights. So happy to answer any questions or concerns.
Sam, I wanted to ask about Moderna and J&J. A lot of people are asking. So do they have, is there a best guess of when the booster's available? You said they're just discussing it now, maybe the end of the month?
We hope by the end of the week, but we want to be sure not to speculate. You know, at one point in time,
right,
thinking that it would be 8 months for boosters, but then it turned around to be 6 months. And so
I see.
We know that meeting occurred Thursday and part of Friday. So we're still waiting to hear the official word on what the CDC director will put forth for everyone to go ahead and implement.
Okay, because I hear everyone can get a Pfizer booster at pharmacy. Most everyone can, if they're in a certain category or whatever. Everybody's telling me they can get a Pfizer booster pretty easily. But thank you for that. Is there any other questions for Sam?
Yeah, Sam, there's been some questions around here about people asking if they can take a flu shot and booster shot at the same setting. And some have said, no, we've heard that you can't, you should wait a couple of weeks. And some of them are going ahead and doing it. Your opinion or what you know?
The CDC has noted, and there are state partners as well, that you can do it at the same time. So if you're pressed for time, highly encouraged to get both if you're due, but certainly understand if folks want to stagger those, but it is possible.
Thank you.
Sam, what about,
yeah.
Oh, sorry.
No,
what about the population under 12? Do we have any idea when they will be eligible to get vaccinated?
We hope soon. That meeting for the ACIP is scheduled for November 2nd and 3rd. So if it's anything like the other previous meetings where they've expanded the emergency use authorization or updates on boosters and things, they'll have that meeting and then hopefully shortly followed by a series of CDC meetings, and they'll hopefully in short order provide that recommendation shortly after. So we were hoping that it'd be at the end of October so that we'd have at least November to get those vaccinations in. So at least those can 5 to 11-year-olds can be vaccinated before a lot of the holiday season and everything, the end of the year. But it looks like that meeting isn't scheduled till beginning of November.
And did you know if that is approved, will the school be able to host like a vaccinations site there in order to get more kids vaccinated, especially for grade school?
That would be up to our school district partners, and certainly if there's a need or a desire to do so, we're happy to support. And we know that there are several other community partners, pharmacies and hospitals and clinics that would be, I'm sure, no doubt willing to assist with that in different ways. At this moment, we know that vaccination access is pretty good in our community, given the amount of our hospital partners continuing to do so and our pharmacy partners available, as well as ourselves here at the health department. So,
Thank you.
Any other questions for Sam? Thank you, Sam. Always great to get your updates. Thank you so much. I did want to ask some of the cities, is everyone meeting the city council meetings, are they meeting at, but maybe in a bigger space? Can I get a handle on what they're doing? Maybe like City of Iowa City, I think you're meeting in a bigger space. Is that still true?
Yes, we're meeting at the senior center.
And what's Coralville doing?
Hi, this is Megan from Coralville. We are meeting in our city council chambers, but of course we require masks in all city buildings.
Thank you. And then North Liberty?
North Liberty is meeting in council chambers. The council's wearing masks. Some of our guests have not, but we're not kicking them out either.
See, and a City of Tiffin?
We are meeting in our council chambers, but we are significantly spread out and we have limited the number of chairs, for the audience. But that hasn't been an issue to this point.
Okay, thank you very much. That's helpful. Okay, let's go on. There's not any other questions there. Let's go on to the third agenda item, update from Iowa City Community School District on federal relief dollars planning and any plans for rapid COVID testing offerings. The City of Iowa City requested this be on the agenda. Would the school district like to comment?
Sure. Do you mind just repeating that one more time, Louise, to make sure I catch all parts of it?
Yeah, it's an update from you on federal relief dollars planning and any plans for rapid COVID testing.
All right. Yeah, I was aware of the relief funds, the rapid COVID testing threw me there a little bit at the end. The relief dollars for us, guys, came in 3 different allocations. We had provided a presentation to the board here, I believe, towards the end of the summer. For us, staffing happens in the spring, and so allocating those dollars out really happens prior to the school year. So that presentation is loaded on our website, and anybody's able to access it. I think one of the key parts in our presentation talks around the 80 FTE that we worked, or close to 70 to 80 FTE we worked to add on the teach and learning staff to try to address things around learning loss. Some of that goes to elementary classroom teachers. We work to move our RAM levels from RAM 2 through 5 to really 1 through 4 for our buildings. And so typically our largest class sizes would be in those RAMs 4 through 5, if that gives you a measure about how those levels work. And then we really try to allocate a lot of the resources maybe to some of our more structurally disadvantaged schools. And those are the schools you'd see in the RAM levels 1 and 2. And so that creates some tough conversations though, right? Because with larger class sizes, knowing we're still in a pandemic, some of those larger class size schools, that's still a tough thing for, but we did try to shift everybody down a level. And so that's where some of the classroom teaching supports would have went at the elementary level. We've also had academic support teachers employed at the elementary level to address some of those tier 2 and 3 interventions that are really how we try to respond. So we always start with core instruction, and then what are the interventions that come along with that. And so more academic support teachers to help with that. And then secondary, same way, and lens of thinking that we had added additional classroom staff, and then also academic support folks to help with instruction at the secondary level. There might be other things that you would see on there that sound familiar. Summer school this past year financed some of that. Of course, there's a whole host of different categories where you'd find some of our different expenses for technology and some of those components that we've talked about throughout. But without kind of going through the whole presentation, I think that gives you an idea of really where those three different allocations of dollars went. We did a survey to the community and really tried to align the priorities we heard back in that lens around mental health, learning loss, health and safety, as far as those big priorities to where those expenditures were outlined. So along the mental health end, you can imagine things like additional counseling and student and family advocate support were something we built into the system there as well. Curricular purchases so we could roll out an SEL curriculum for our secondary schools and things like that. So again, you can find that all on the website. That's part of our plan that we have to post, is how those dollars are spent and what our plan was. And so we've continued to update. It seems dated now to call it a return to learn plan, but that's how we started referring to it. And so that's continued to evolve and be posted there so that we're transparent and open with the public. The rapid COVID testing, we've worked with the state to try to be a test provider through their program. I don't have an update on that this week to know if we've been approved officially through the state. We submitted it through the state portal. CASA, I had to submit that through there. And so they have our application, but we've had test kits available through our healthy kids clinics in the districts, healthy kids clinics, so that families could access those, because we know getting a hold of sometimes those test kits a little bit more challenging, or to get a test scheduled. So any family that is not able to get a hold of those, or if time, or any resource is really an issue in doing that, please contact your school health office, and they'll refer you to the easiest place that you could get a hold of one of those. We've seen good trends in our data. We have positive cases going down. I think when I left on Friday, we were updating the dashboard, and it was our lowest amount of COVID positive students that we've had since the second day of school. So I think that shows us what the mask requirements been helping assist do. Also, I think people just staying vigilant. Sam talked about vaccination rates. All of those different components, of course, play into it. It's not any one factor. It's a multiple layered mitigation strategy that we've been continuing to use. But the second most exciting thing, other than lowering the amount of people getting infected, I would say, is the amount of quarantines that are extremely down too. So we have kids that staying at school, staying in front of instruction, and staying learning. And so that was much more challenging without a mask requirement as well. Then we were not able to keep kids and having to send kids home for a period of time, or staff home for a period of time as well with that. And so a lot of positive trends on that front. So that's kind of the update around those two areas, unless anybody has additional questions I can answer.
Thank you. Any additional questions for a superintendent? Thanks again. That was a very good report, complete. We'll go on to item D, November PEPL and SAVE, SAVE votes from the school district.
Yeah, that's me as well. So I'll just keep at it here, Louise. Thanks. So in November, we know that there's obviously the elected officials that are up for re-election or seeking candidacy, and we're certainly a part of that here in the school district with our board elections. But there's another important vote for us that voters will see on the ballot as well, and that's the extension of the SAVE and PEPL levies. And I got to use that word a little loosely, levies, because if we break it down into details, it gets a little more confusing than that. So the PEPL levy is a voter approved levy at $1.34. The board approves an additional 33 cents, but the PEPL levy is for $1.34 and $1,000 taxable valuation. And that for us would expire in 2025. So we're really trying to get that extended through 2035 would be what we would ask the voters to consider. It's a 50% threshold to extend that PEPL. And so it's actually the physical plant and equipment levy. And so some of the things you would kind of think about in this lens are really operational expenses, right? And so we try to keep our operations on a life cycle format and keep replacing some at a time, as I'm sure you guys talk about in your governmental structures too. You don't want all those needs coming up at once. And then the other portion of this is really the SAVE, or for us, the revenue purpose statement. And so the revenue purpose statement that we're asking voters to consider approving allows us to take those 1 cent state sales tax dollars that are already extended through 2050 and use those again for some of those operational costs. People may ask us, okay, well, why do we want to do that? Well, there's a couple of reasons we want to do that. One is if we don't have those funding sources, then that puts additional pressure on our general fund for operational expenses. And we know that 83 cents of every dollar we spend goes to a person. And so we want to keep as many of those people working with our kids as possible. That balance, actually 83 cents here in Iowa City, is pretty high for school districts. Usually they say a healthy range is between 75 cents and 80 cents. And so we're a little high, but that's a cost we've become accustomed to and something we think is important for our kids and for our staff to keep providing a high level of service in the teach and learning arena. But if those operational expenses aren't able to be funded through these other mechanisms, then you can tell how they move in and start to compete with that. And we can't give up on all operational expenses. So somewhere it would have to give for us a little bit. The second factor that we've talked a lot about since last winter, we started engaging in this conversation, and then throughout the spring and into the summer, was how we construct a second facility master plan. We know that we're just completing our first facility master plan, and that we did it under time and under budget, 8.5 years instead of 10, and under the amount of money that we thought it would take us. And so I think we've established good trust and credibility as far as executing the plan, not just designing it, but also executing it in a really efficient way. And so as we look for those two different funding sources to continue, then this would help us execute that second facility master plan. On our website, you'd find a lot of history and a lot more in-depth information around this that would show the 3 buckets of categories that we've created for the second facility master plan, which really includes completing the promise FMP 1.0. So those needs that we identified through the first facility plan but weren't able to do, or things that just, okay, well, we did the basic level of needs. Now what else do we need to do in there? And so things like classroom space, supporting the whole child, so athletic and fine arts and music upgrades would all be an element of that on some of our campuses as well. A couple quick examples, you can think about Hills Elementary School, our need and desire to want to do a new elementary school there. City High's athletic campus with the old Hoover building there. Those would be a couple things you'd find in that first list. The second bucket is really those life cycle projects that we talked about. We want to stay up on those. We were able to do that through the first facility plan and do our HVAC upgrades. And we were so thankful for that as COVID came upon us, that we were ahead of the curve on those HVAC components. But air conditioning was a big one in that first plan. Well, we don't want to find ourselves in that position we found leading up to FMP 1.0, where we had so many needs and had so many desires to do things that we really need to keep those life cycle projects going. And even some of that conversation goes to our climate action initiatives and keeping that front of mind as we approach those life cycle efforts. And then finally, the third bucket is how we want to think about the future and how our teach and learning programming opportunities should start to drive our conversations around facilities. And so what do we want to do differently? What do we believe around things like early childhood education and trying to expand opportunities for families and students in our school district that way? And then how does that affect our grade level configurations potentially at the middle level of education if we take on more students into our buildings on a daily basis with additional preschool opportunities? What does it mean for learning pathways and CTE programming for our students? And so that's really those long-term conversations. You could talk about magnet schools or STEM schools, any of those things that really filtered up to us through the stakeholder priorities would be conversations we'd want to continue to engage the community around. So that's a lot of words, but to boil it down, it's really about extending the PEPA levy and approving our revenue purpose statement for the district. There's no new tax to the voters. Those are already existing taxes that are in play. The state sales tax you're going to pay no matter what. The PEPA would just be a continuation, and then it would give us the flexibility to really accomplish those two big goals like I talked about, to keep pressure off the general fund and to allow us to look towards a second facility master plan to move forward with here in the district. And when I talked to the press citizen today, she asked, well, what's the biggest reason, or one of the biggest reasons you would tell people to consider this? And I said, I just think it's really down to the question of what kind of experience we want to provide our kids in the Iowa City Community School District. And that's twofold, because we really talked about this second plan as a teach and learning opportunity that we can design spaces for the future and for the next generation of our students and really have programming conversations that drive how we look at facilities. not just trying to get portables off campuses and just get air conditioning to our buildings. I think this is about providing that excellent experience we would expect the Iowa City Community School District to provide. So we're excited about it. We're pretty cautiously optimistic. It's a low threshold, 50%. It's not the bond threshold of 60%. We were excited to bring forward to the board that we would not need to go ask for a general obligation bond to do this second plan. And I think that's respectful of where people are at right now, just knowing we're coming off a global pandemic and the economic conditions as they are. So I think it's reasonable. It's no new tax and allows us to keep moving forward so we don't find ourselves in a situation where we're really trying to pull off a major plan with another bond after years of need. So any questions on that one, I'd be happy to talk through too, but please visit our district website. Reminds you of the vote, shows you all the work that we've done leading up to it.
Any additional questions? Yes, thank you.
Just one thing on there, folks, for the save for the RPS revenue purpose statement, you got to flip the ballot over. So make sure to take a look at that. Make sure you flip that ballot over so you don't miss the opportunity to weigh in on that revenue purpose statement.
Any other comments, questions? Thank you very much. I want to talk about the next meeting date and time. I talked to Jill Wagner, Assistant Administrator of Johnson County, and she said Johnson County, it's probably their turn. She said, we usually meet, the third Monday. That would be January 17th, but that is the Martin Luther King Day, and they will be closed. Offices will be closed. So I'd like to suggest either the second Monday of January, which would be January 10th, or the fourth Monday of January, which would be January 24th at 4:30. I'm just going to suggest the fourth Monday, January 24th. Does that work for most people? For the majority?
That sounds good.
Okay. Thank you, Pat, for responding to that. And I take no other response as that works for most people. So the next meeting will be by Johnson County, and then we'll see if we're in person or what on January 24th at 4:30. Is there any other business anyone would like to bring up?
I would just suggest that everybody do everything they can to get people out to vote. City council, the local elections in which we all participate are usually really low turnout elections. We all know that that our entities make a big difference in people's lives. So anything anybody can do to get people to vote, please do it.
Any other comments, business? Is there any objection to adjournment? Hearing none, the meeting's adjourned by unanimous consent. Thanks, everyone, for taking time out of your day. See you in January.
Thank you.
Bye-bye.
Bye-bye.